Increased prostaglandin raises temperature set point. Neutrophil arrival and function. Step 1 Margination. Vasodilation shows blood flow in postcapillary venules. Cells marginate from center of flow to the periphery. Step 2 Rolling. Selectin speed pumps are upregulated on endothelial cells. P-selectin releases from weeble palate bodies is mediated by histamine. E-selectin is induced by tissue necrotic factor and interleukin 1. Selectins bind Cy-Lewis X on leukocytes. Interaction results in rolling of leukocytes along vessel wall. Step 3 Adhesion. Cellular adhesion molecules ICAM or VCAM are upregulated on endothelium by TNF and IL-1. Integrins are upregulated on leukocytes by CFA and LTB4. Interaction between CAMs and integrins result in firm adhesion of leukocytes to the vessel wall. Leukocyte adhesion deficiency is most commonly due to an autosomal recessive defect of integrins CD18 subunit. Clinical features include delayed separation of the umbilical cord, increased circulating neutrophils due to impaired adhesion of marginated pole of leukocytes, and recurrent bacterial infections that lack pus formation. Step 4 Transmigration and chemotaxis. Leukocytes transmigrate across the endothelium of postcapillary venules and move toward chemical attractants chemotaxis. Neutrophils are attracted by bacterial products interleukin 8, C5a, and LTB4. Step 5 Phagocytosis. Consumption of pathogens or necrotic tissue. Phagocytosis is enhanced by opsonins IgG and C3a. Pseudopores extend from leukocytes to form phagosomes, which are internalized and merge with lysosomes to produce phagolysosomes. Chiari-Higashi syndrome is a protein trafficking defect, autosomal recessive, characterized by impaired phagolysosome formation. Clinical features include increased risk of pyogenic infections, neutropenia due to intramedullary death of neutrophils, giant granules in leukocytes due to fusion of granules arising from the Golgi apparatus, defective primary hemostasis due to abnormal dense granules in platelets, albinism, peripheral neuropathy. Step 6 Destruction of phagocytosed material. Oxygen dependent killing is the most effective mechanism. HOCl generated by oxidative burst in phagolysosomes destroy phagocytosed microbes. Oxygen is converted to O2 free radical by NADPH oxidase oxidative burst. Oxygen radical is converted to H2O2 by superoxide dismutase SOD. H2O2 is converted to HOCl radical bleach by myeloperoxidase. Chronic granulomatous disease is characterized by poor oxygen-dependent killing due to NADPH oxidase defect, X-linked or autosomal recessive, leads to recurrent infection and granuloma formation with catalase-positive organisms, particularly Staphylococcus aureus, Pseudomonas Cepacia, Serratia, Maricians, Nocardia, and Aspergillus. Nitro-blue tetrazolium test is used to screen for CGD. Leukocytes are incubated with NBT dye, which turns blue if NADPH oxidase can convert oxygen to oxygen radical but remains colorless if NADPH oxidase is defective. MPO deficiency results in defective conversion of H2O2 to HOCl radical. Increased risk for candida infections, however, most patients are asymptomatic. NBT is normal, respiratory burst is intact. Oxygen independent killing is less effective than oxygen dependent killing and occurs through enzymes present in leukocytes, secondary granules, for example, lysozyme in macrophages, and major basic protein in eosinophils. Step 7 Resolution. Neutrophils undergo apoptosis and disappear within 24 hours after resolution of the inflammatory stimulus. Macrophages. Macrophages predominate after neutrophils and peak 2 to 3 days after inflammation begins. Derived from monocytes in blood, arrive in tissue through the margination, rolling, adhesion, and transmigration sequence. Ingest organism through phagocytosis augmented by opsonins and destroy phagocytosed material using enzymes, for example, lysozyme in secondary granules. Oxygen independent killing. Manage the next step of the inflammatory process. Outcome include resolution and healing. Anti-inflammatory cytokines, for example, interleukin 10 and TGF beta, are produced by macrophages. Continued acute inflammation marked by persistent pus formation. Interleukin 8 from macrophages recruit additional neutrophils. Abscess, acute inflammation surrounded by microfibrosis. Macrophages mediate fibrosis through fibrogenic growth factors and cytokines. Chronic inflammation, macrophages present antigen to activate CD4 helper T cells, which secrete cytokines that promote chronic inflammation. Thank you.